Hi, everyone, again. Thank you all for being here. Our goal today is to give you some insight first on our wonderful managing veterinarian of EVS Pet Urgent Care of Niagara, and give a little bit about his background. And we also want to give a bit of background on what EVS Pet Urgent Care is all about, what the services we're going to offer, and just diving in a little more to what urgent care is. So I'm going to hand the floor over to Dr. Brown. We're so happy you're here. Tell us a little about yourself and take it away.
Well, I graduated from Ross in 2005, promptly moved here to Tonawanda, New York here, and did private practice for 8 to 10 years, switched over to emergency. I did that for, probably 5 or 6 more years. Got a great opportunity to be the inaugural veterinarian at the Niagara SPCA. Gladly took that. And unfortunately, due to circumstances, that lasted about 3 years. So I came back to private practice, and COVID promptly hit. Veterinarians being overwhelmed. I mean, it was a good problem to have, I guess, for veterinarians. We were extremely busy. But in the culmination of that, things haven't eased up very much. And I certainly noticed that there was a link missing for those veterinarians are overwhelmed. They can't get their patients in. They're doing the best they can, overly stressed. And so they can't get them in for week, maybe 2. And so, these owners, they don't quite feel it's emergent, but they can't wait 2 weeks either. So they end up going to emergency. That emergency as well is overwhelmed. There's big waits. And so they're stressed out, and there's this disconnect there. And I think this is going to be the great fit to ease my general practitioners, ease the emergency veterinarians, help clients. Just all around makes everyone much happier, more satisfied, and they go right back to their veterinarian, and all those alliances stay put, and everything is well. Well, I graduated from Ross in 2005, promptly moved here to Tonawanda, New York here, and did private practice for 8 to 10 years, switched over to emergency. I did that for, probably 5 or 6 more years.
All right, I think we should dive into a little bit about what COVID did to our profession, because you really hit it. You hit it for me. And I'm not sure that the clients really know how we all felt. They were very frustrated and mad that they couldn't get their pet in, they couldn't come in the door, they couldn't get someone on the phone. And I think that we need to kind of tell our story of how did we feel as veterinarians. So, I'm going to let you go first, because I have a lot of feelings on what happened there. And it was a big impetus for why EVS was even established.
Yes. Well, it just immediately started out very frustrating. One, the clients can't come in the building. You have to go out, get their pet, come in, sort of get what history you can get. If you need more questions, you have to phone them. There's just this disconnect there. I mean, even just the face-to-face, not having that, I think was troubling. You lose a lot of communication, and there's a little disconnect personally there. And if there happens to be an issue, or you notice something on exam, well, then you have to talk to them again on the phone, and then maybe get an estimate, and can you do the procedure? And it was just all around very frustrating for everyone involved.
Yeah, it took away all the joy, the satisfaction, that human connection.
Yeah.
And I remember leaving those days at work completely exhausted, drained. I felt like I had nothing left to give at the end of the day, right? Like you'd go home to your family, your kids, and like you were just toast because you just literally been on the phone for a good 8 or 9 hours.
You also didn't feel like that fatigue was fulfilling. I mean, you just felt it was just an empty, like I'm just dead tired but you still feel fulfilled in what you did to work that hard. It's deadening.
And so like, if I could just kind of turn that as to like why EVS is different. And because we do not treat clients like an obstacle to care. We treat them as part of the process of making sure that they truly understand what those physical exam findings are. Why are we recommending these diagnostics? And the beautiful thing too about this urgent care model is we're getting those results of the diagnostic during their exam there. So there's not that follow-up of needing to call someone the next day or in 5 business days when those things arrive, because we're getting it in the moment. Whether it's blood work results, urine, fecal results, cytology, or even x-ray. Our digital x-ray is getting sent out for review as well. Very cool. I would like to share this with everyone that we actually have an AI review within 5 to 10 minutes, and then a specialist review within 45 minutes. So you're actually having 3 reviews, you as the doctor, AI, and a specialist reviewing these films, all within the time frame of you being in the clinic, which allows clients to then know, what do I need to do next? Do I need to go to a specialist? Can I follow up at my general practice? Is this something that doesn't even need a follow-up? So just that communication is so full and complete and in the moment. It's like nothing I ever dealt with before.
So I think on that topic of, what someone might expect and getting same day results, maybe Dr. Jordana, you can just walk us through, how does someone get to EVS? Are they being referred? Can they walk in? What does it look like to have a visit at one of our clinics? So I think on that topic.
So the majority of our clients are coming to us as direct referral. And we spend a lot of time getting out into the community and really making great partnerships with clinics that are sometimes literally across the street from us. We don't see them as competition, and because of our model, they don't see us as competition. They truly see us as a partner and an alternative to the emergency room when they cannot get their clients in. Some of the clinics in our surrounding areas have been in the community for almost 100 years. So these are clients that are generational. And sometimes, especially during COVID, when we get into those vets were saying, I'm sorry, we can't see you for 2 or 3. Not because they didn't want to see them, because they physically could not do it. We were all pushed to the brink there. So the alternative of waiting 2 or 3 weeks was going to the emergency room. The emergency room plays an important role. We need them for when there is a true emergency, when pets need emergency surgery or hospitalization or advanced imaging. But on a day-to-day urgent care basis of, let's call out the ailments, eye infections, ear infections, skin infections, lameness, vomiting, diarrhea, the list is pretty exhaustive. But those cases don't belong at the emergency room, because what happens there? You spend a lot of time and a lot more money, because it costs more money to operate an emergency room. And when we think about the staff they have, the medications they need to carry, their equipment they have, the hours they're open, it makes sense that their prices are the way they are. But by having this urgent care alternative, clients and their veterinarians have an alternative. So that's where the majority of our clients are coming from. But you don't need a referral. So if you find us on Google, on Facebook, on Instagram, on anywhere else on social media, or you are watching this Facebook Live and you know that we are going to be available, we're walking. So even if you decide you're not going to follow my instructions and download the app and save yourself some time, you can still just walk in and we will take care of you. As long as we're open, we are there to help.
Amazing. Thank you. And yeah, Dr. Brown, you're actually physically in the clinic right now.
Correct.
Now I know it's under construction, but maybe you want to kind of give an overview of, what it looks like. Give our, guests here a little
through a
sneak
little
peek
bit,
into it.
or
Oh yeah, let's do a walkthrough.
All
This
right.
is exciting. Let's go.
All right. So right now I'm in an exam room, but I'll come outside and we can, as if we're walking in.
I love it.
All right.
So much natural light in the clinic. And I have to say, every clinic I've ever worked at didn't have light. So I'm very jealous. I'm moved to New York. I'm going to come and work with you. It's so beautiful.
Absolutely. Yeah, so we're here, 1089 Kincaid here, Suite 111, right here in North Tonawanda. Literally right across the street from the high school over there. So as you come in, there is the main building where this little building over on the side. And see my little dog there? That's Molly. So as you come in, there will be a tablet right up there. So if you walk in, you need to get the app, you can do so. And then there'll be a small little waiting room here. Once we take you in, you'll come right down here to one of the exam rooms. Here's one. We have several. You can see we're studying for things. Once we take you out of the exam room, we will come here to our treatment area, which over here, I'll start here. We'll have a full lab here, blood machines, our microscope. We can do fecals, full CBC chems, your analysis. In here, we will have our x-ray unit, so we'll be able to take radiographs as well. And then all of this here is our treatment area. We'll have several tables set up here to do whatever we need to do. We have several shelves and benches and tables. So we're fully functional. We'll be fully adequate to take care of anything that you might need.
Looks so good. And you might be wondering, like, that doesn't really look ready yet, but everything is going to be there within the next 2 or 3 weeks. We're going to be, barring any complications that we don't know, ready to go on September 5th. So it's going to be right around the corner. Looks wonderful.
Looks great.
Yeah. I mean, maybe we can just talk a bit about what we don't see, what would be appropriate urgent care versus, this is not the right place for you.
Sure. First off, it'll be your prevention, your vaccines, your flea treatments, your heartworm preventions, all that kind of stuff. And then on the other end, it's going to be essentially anything that's going to need 24-hour care, emergency type of surgical things or medicinals. We'll certainly be able to stabilize and do what we need to make sure that your transition to an emergency clinic is smooth and they have all they need when I'm done here. And your pet is stable and okay to go there as well. But in general, it's on one end is the preventative type aspect of vaccines and fleas and heartworm. On the other end, it is essentially the emergent things that are going to need overnight care, constant care, that sort of aspect where it has to happen right now, and they're going to need to be monitored for a considerable amount of time.
I think it's, very well said. And something I just want to emphasize too is that referral piece. So I need to just tell a little anecdotal personal story. My son had an injury. He fell off his scooter a couple weeks ago, and I took him to urgent care. And they said, I think you're going to have to go to the emergency room, but let's take some x-rays here. We took x-rays. They said, yep, we need to go to the emergency room. I got to the room. Urgent care never sent over the records. We had to redo everything that we had done in urgent care. Not only but also heard. So we do think, yes, most importantly, when making those diagnostics, when we know what medication to give, we are sure that record is not only written up and given to the client and sent to the emergency, but we're calling that emergency room and saying, listen, I have this diagnosis. Can you accept this transfer? And also give us an estimate of what it's going to cost to the client, because these are not small bills, and we want to make sure that those clients are going to be prepared and not get to the emergency room and have a surprise and then feel trapped and not know what to do or where to go from there. So just saving time, saving money, and really having a transparency with our game plan with all parties involved. So that to me, it spoke volumes to me, and it made me feel really validated in our model of how we're doing things and how we're communicating to make that transition so much smoother. I think we just have to get this record straight. Chris, speak to us like a local and tell us where the clinic is located.
So like I said, it's on Kincaid Avenue. It's in North Tonawanda, right across the street from North Tonawanda High School, pretty much right in the heart of the town, right off Meadow Drive. Again, very close to Niagara Falls Boulevard, very close to the Erie County border, right in the heart of North Tonawanda there on Kincaid Avenue.
Perfect. Hopefully that clears it up for all of you people that questions. I'm sure there will still be questions to come, and hopefully no one took any offense to any of our ways we were describing it, but that's great. That's going to continue to be a learning experience until this is very established and everyone knows where we're located. Abby, any other questions that we didn't hit on there? And then we can maybe get to some of these questions that our viewers have.
Yeah, no, I think we hit on all the questions. A lot of people wanted to know what we treat, dogs and cats. We are walk-in facility, no appointment needed. And I think you guys went over, some of the cases that might have come in to the urgent care versus ER or general. So I think we can move on. If anyone that's watching has any questions, feel free to leave them here. Oh.
Well,
wait, we do have a question actually from one of our viewers, Lisa. She's asking, if a pet just needs fluid therapy, can you accommodate that?
So if they're talking about subcutaneous fluids, then yes. But if we're talking about hospitalization with an IV catheter, that would not be in our wheelhouse.
Okay. Great.
I definitely could not, we cannot end this live without, kind of giving a little bit of background about how Dr. Brown and I know each other. So, I don't know. Do you want to go or do you want me to go? I don't know. It's such a great story. It needs to be.
You can start. I can fill in some blanks.
All right. So, I'm not a very good rule follower. So when I was living on St. Kitts attending Ross University, I really wanted to get a dog, and the apartment I was living in did not allow dogs. And so I hid this dog for a good couple of months, but listen, you can only hide a dog for so long. And the apartment complex got pretty angry with me, and they said, listen, you either got to, move out or get rid of the dog. And I was like, well, heck no, I'm not getting rid of the dog, obviously. So I was studying in school late one night, and, Chris and I are roommates, and he sees me studying, and he's like, Jordana, like, what are you doing here so late? And I was like, oh, I can't go home because I got this dog. And he's like, wow, it's so weird because one of my roommates is moving out. You know who you are. Nice love connection there. Thank you. This might not have happened otherwise. And I moved in with Chris and one of our other classmates. And it was, it was a great couple of months. We had a lot of dogs in that house. Chris, how many dogs did we have in that house?
Well, I think she had 6 pups, and we had, one, 7 or so, 8. We had a number.
We had a lot of dogs. And I'm going to do a shout out to your wife, Kim, because this woman is a saint, okay? She came over and was like cleaning our house. Now, she wasn't his wife at the time. So, this was really more of, making sure he knew what he was going to get. And I think you got a winner there, Chris.
I agree.
Yeah. So just such an amazing story for, me to have one of my classmates. When you go to Ross University, you're living on an island for, just over 2 years, and these are people that become your family. And if you don't talk to each other for several years, the connection is just so strong. And I couldn't be more excited or happier to, have you on board and getting this going.
Feelings mutual. 100%.
I have some of our classmates, join us here, which was really exciting. So
that's fantastic.
Yeah, let's go. I think I know who said it down there. I think it was even Kim. We need to do a reunion. Back to the Caribbean. Let's go.
Let's go.
We actually, sorry to interrupt. I just wanted to get to another question that we have here. When a client puts in a description of what's going on with their pet, will the app recommend e-clinic if not appropriate for EVS?
So the app is going to have several drop downs as to why you're bringing your pet in. If your pet is not falling into one of those categories and you're confused, we still have phones that are, you can call us and ask us, is this appropriate? Is this not? So one other thing that I want to mention is our phones are answered off-site. So I don't know how many of you can, this resonates with, but a lot of times at veterinary clinics, those phones are ringing nonstop. It's distracting. It also makes it so that those receptionists that are up front have a really hard job of giving their full attention to the person calling, as well as full attention to the people in front of them in the lobby. So by having those phones off site, our remote triage operators are really able to dedicate the time and attention needed for each of those calls. And there's also direct communication with the clinics. So sometimes even our remote operators might not even have the answer, and they'll be able to, call in to the doctor and say, is this something that should come or not? But definitely, if you have a question, give us a call. We're always happy to make sure that you're going to be sent to the correct location.
Okay, thank you. And another question, this is for Dr. Brown. It's amazing, but will Dr. Brown still be a private practice?
I will not. I will not. I'm going to devote everything to this.
But that's, the important piece too. Having those connections with the local veterinarian, right? Like we know who they are in town. We get a better sense of, are they taking new clients? How quickly can they get you in? Be able to direct you, even if you maybe don't have a vet yet. And by kind of centering ourselves as almost, like an octopus or so, having multiple spokes to all of those other clinics, direct lines of communication, I think really helps for us to be able to serve the community best.
Definitely. Okay, last call for any final questions. We're happy to answer. And if anyone has questions that didn't get answered during this live, leave us a comment on our Facebook, message us any of our social media platforms, give us a call. We are so happy and so excited to be serving this great community.
Thank you guys so much. This was so fun. I apologize for the rough start, but the next one will be even better.
Okay.
Thank you everyone for doing this.
Thank you guys.